they take may be hazardous to their health. Good evening. I'm Brian Hackney.
And I'm Wendy Takuda. Tom Sinkovitz is off today. The Food and Drug Administration is under the microscope, accused of failing to protect the public. The charges come from an FDA drug safety officer. He stirred up a controversy saying that 5 drugs currently on the market are just as dangerous as Vioxx. That is the anti-inflammatory painkiller that was pulled off the shelves recently because it was linked to an increased risk of heart attack and stroke. The 5 prescription drugs in question are widely used. The drug makers defend their products, saying if used correctly, there should be no ill side effects. But what do you do if one of the FDA's top safety experts is the one sounding the alarm? KRON4's Linda Yee in the newsroom to tell us about the 5 drugs. Linda?
Oh, Wendy, the very drugs that are supposed to suppress your pain, lower your cholesterol, treat asthma, acne, and obesity can now be dangerous to your health? Well, some patients have already hit the panic button.
Well, he's certainly been flooded by phone calls.
Rheumatologist Dr. Neil Birnbaum of California Pacific Medical Center says news that 5 prescription drugs could be dangerous has sent some patients into a panic unnecessarily. He prescribes the painkiller Bextra, a drug that may double the risk for heart attacks and strokes for people with heart disease. But Dr. Birnbaum says everyone is different.
A patient who's got a significant history of ulcer disease may very well do fine on Bextra, whereas a patient who has a history of heart disease may want to be concerned about it, or they may want to add a baby aspirin to the Bextra.
It's been known that Accutane, the treatment for severe acne, can be dangerous. It's linked to birth defects and fetal death when used by pregnant women. That's why doctors who prescribe Accutane say they're selective about who gets it.
We get a whole, list of blood work. We double check on the pregnancy, make sure they're not pregnant. They have to sign 3 consent forms. So it's a pretty rigorous procedure. And then we follow them carefully every month.
23 million people currently take Ceravent for asthma, but studies in England showed it can worsen conditions, even be deadly. Meridia, which treats obesity, is linked to heart problems and stillbirths. There are currently 15 million patients on it. Crestor is the newest anti-cholesterol drug in the same class as the popular medication Lipitor. Crestor is linked to muscle-destroying side effects. For the millions of people on these drugs, caution is key, but to suddenly stop taking them is not advised.
People shouldn't stop their drug cold turkey, and it depends on the individual drug. Some drugs, like Bextra, you might hurt. Other drugs, there could be more serious consequences, so no one should just stop a drug. Talk to your doctor first.
And here's something to really think about. Doctors say even taking aspirin inappropriately can kill. And Tylenol, which is supposed to be safe, is one of the most dangerous drugs on the market. Long-term use or higher than recommended doses can cause liver or kidney damage. I'm Linda Yee, live in the newsroom. Now back to you, Brian.
All right, thanks.